Welcome, everyone. I really appreciate everyone who's on today. And I wanted to just kind of quickly intro by saying that, the topic for today, doing anti-oppression work in rural areas, came from a lot of the feedback that we were getting from programs in the rural areas of PA. As you know, our prevention work is getting to include more social justice work. A lot of folks in rural areas wanted more resources, tools, discussion about what does that specifically look like in rural areas. So today we have David Hyde, the Executive Director of A Way Out up in Potter County, and he will be talking briefly about some of the work that he's doing up in Potter County in a rural area with around social justice, anti-oppression work. And then Christina Hesbol is an assistant professor at the University of Denver in the College of Education, and she will be talking more so about kind of giving us a better idea of some tools, resources, ways to be thinking about doing this type of work in rural areas. So first up, David.
Okay, thanks, Nick. My name is Dave Hyde. I'm the Executive Director of A Way Out, Potter County. And we've done a fair amount of work around poverty and how poverty and being in a rural area plays into cases of domestic violence. We were one of the recipients of the Community Readiness Grant, and we're able to really take a look at how economic status plays into cases of domestic violence in an age range from 21 to 65. Potter County is a really large county with a small population. Resources are very limited. We do not have any type of public transportation system. People have to travel long distances to potentially access any type of service. So we were able to really look at all of these factors and how they play into domestic violence. And really what we came away with is, yes, all of these factors do play into cases of domestic violence. And I think what we were able to do as an organization was to bring the two together. I think people were always looking at it as poverty and domestic violence as two separate things. I think we were able to more bring the two together. As an organization, it gave us a lot of depth in being able to really go out to stakeholders and community members and collaborative partners and be able to really bring this into a lot of different avenues throughout the county. So I think, it's allowed us to really work more effectively with outside agencies. Definitely though, with the lack of resources and us being so rural, it really did come through that the two really do go hand in hand.
Awesome. Thank you. Can you talk a little bit more about how kind of talk to the community about addressing these two things together?
So what we did as an organization was we did it through like town hall meetings. I personally, as someone who sits on a lot of different committees throughout the county, have been able to bring it into a lot of different avenues. For example, like our CJAB, our Criminal Justice Advisory Board, our local housing options team, county mental health task force. It's allowed me and my staff to really, I think, bring it into, a lot of different avenues that they do every day and really deliver that back out to people.
Can you talk about how you explained it and kind of what was the response from the community for connecting poverty and intimate partner violence, or DV?
Well, I think we were able to, after we completed the first round of community readiness, I think that's when we were really able to roll it out and give specifics around, like lack of housing, lack of, people who may have like food insecurities, who may not have transportation, like being that we don't have a public transportation system. I think, being able to really roll it out in a way that we were able to give very specific examples of different things that could play into cases of violence, I think was where we were able to potentially get buy-in from like outside agencies, community members, things of that nature.
Awesome. Thanks, David. And if anyone has any questions for David, please feel free to type in the chat and can read them out loud and have David answer them. And if you have, we'll give a couple minutes for that, but if you have more questions later on, feel free to throw them in the chat because there'll be time for discussion at the end as well. Well, thank you, David, so much for sharing your experience working on addressing poverty in Potter County. One question from Alexandra popped up. Do you have a dedicated prevention staff, or do all staff do prevention work?
All staff do prevention work. We're a relatively small organization, so really all of the staff do some form of prevention work. I would say for this particular, where we looked at, a particular group and how the two come together, myself and one of my other staff took the lead on this. So, but traditionally, yes, everybody does prevention work.
Thank you. Awesome. I'm not seeing any other questions at this moment, but I'll keep an eye on the chat. And then we'll kind of continue moving on to Dr. Christina Hesbol.
Good morning. So I'm a professor at the University of Denver, and you need to understand that my work is the focus is on rural work. I grew up as a poor rural kid and love rural spaces in spite of some of the challenges and opportunities that they offer to us. So I'm delighted to be able to join you this morning and talk a little bit about some tools and some strategies that are useful, particularly in rural contexts, and the anti-oppression work that you're doing, about which you're interested, actually is really exciting because there's so many opportunities to do cross-disciplinary work to really make a difference. So the second slide asks, who are you? And in my work as a professor, when I work as in my teaching capacity, I don't ever just lecture. I want to know who's in the room and what are your needs. So if each one of you as participants would just drop a quick note in the chat box, just with your name, the community in which you work, what you do, and what's really important here is if you could improve one thing about your practice in rural settings, what would it be? So if there were no rules, if you had all the resources in the world, including time and funding, what would it be? And I'll go ahead while you're doing that, and then it'll be really important for us to go back and look at that so we can tailor that to you. So the next slide asks for the outcomes of what we're going to do today. And I'm hoping that you will consider new ways of thinking about the issues with which you're wrestling. I want you to listen to and hear each other. All of us are so deeply involved in the work that we're doing that it's really hard to think that there are other people who have the same issues. As Dave Hyde just suggested, just the proximity issues of really being isolated in remote settings exacerbates the problem and makes it more challenging. But there are ways to network you all together and identify practices that are working really well. You can do that at no cost and be able to build on each other's successes. I want you to be thinking about what's different about oppressive practices in rural contexts than in perhaps non-rural contexts. Very importantly, I want you to consider your own biases as well as what we would call positionality or intersectionalities, and we'll talk a little bit more about that. Your positionality is how you identify, and that would include your race, class, your gender, your sexual identity, your language, and your ability status, among others. Your intersectionalities is that there's not just one of those, there are multiple positions from which we operate. And that positionality influences our biases and the way that we understand the world. So until we surface that ourselves, it's hard for us to know how to really be able to approach the solution to the issues that we're dealing with. We're gonna work on identifying a common problem of practice. So as much as you're spread out from around the state of Pennsylvania, there are some common issues, and the synergy of having you work together, look together at a common problem of practice would be, it's very productive. A problem of practice is very complex. It's persistent. If you knew how to fix it, so to speak, you would have done it a long time ago. But it's not a wicked problem. So a wicked problem is eliminating poverty, and none of us can do that. But all of us can participate in chipping away at the components of it, and those are the problems of practice. We also want you to be able to network with colleagues around the successful strategies that you are using. Some of you don't, it's hard in the midst of all the work that you're doing to even recognize the progress that you're making sometimes. And so to be able to talk through the chat box about strategies that are working would be really powerful to be able to share with your colleagues. And then we'll talk a little bit about plan, do, study, act improvement cycles and how useful they are. They're inquiry based and they're iterative. So a lot of standardized assessment processes test something and you get the data back and you just kind of, the system keeps going the way that it was. It's like autopsy details. I prefer a much more formative, iterative process, and it could be done once you identify a problem of practice and figure out an approach that you want to take. It could be as quick as a 28-day cycle. They're supposed to be short. So you try applying an intervention to it and you see how that works. And if it's working well, you determine what more you need for supports to make it continue or to get better. If it's not working, you look at why it's not working and you make some adjustments to your goal. So I think we'll try to get that accomplished in a relatively short period of time. So there's a report that was released in November called Why Rural Matters, 2018-2019, The Time Is Now. It comes out every 2 years. It's published by the Rural School and Community Trust in Washington. But I refer you to this, even though much of it is educational. There certainly is a great deal of contextual material. And I have a 1-page on Pennsylvania that I'll send to you as well. That's a synthesis of all the data that was collected about the state of Pennsylvania, rural Pennsylvania. And it's actually, interestingly, quite encouraging. And while you may not feel that wherever you are today, normatively compared to lots of other places in the country and other places that can learn from you as well, Pennsylvania has some advantages. A dear friend of mine is working right now in North Dakota, in rural and remote North Dakota, on murdered and missing Indigenous women. There are all kinds of really interesting things that are happening in rural spaces, and we're not alone in doing it. And the work that each one of you do, as I'm watching you post to the chat box, all of you have overlaps and things that you could learn from each other as well as from people around the country. So half of all the rural students in the country attend school in only 10 states, and Pennsylvania is one of them. So as you well know, there's such a large rural population in the state of Pennsylvania, but it's really dwarfed by the attention to the urban and the non-rural areas of the state. And context matters. So one rural space is different from another. So in Washington, Greene, and is it Fayette counties, that's different from Lehigh Valley, and it's different from Lackawanna, and so on. And yet you have some common problems of practice. 19% of the rural students in Pennsylvania receive special education services, and that's an extraordinarily high percentage. The national average is about 6%. And that often is a result of school people not knowing quite what to do with certain kids, and their kids around whom there's a deficit view has been developed. So let's go to the next slide and look at something called equity traps. And equity traps is an article that was written back in 2004, and it's really, I think, a linchpin to shift paradigms. The paradigm shift phrase was developed back in 1969, actually, by a man who suggests that paradigms don't shift until the current paradigm no longer works for the majority. So think about the innovative things that you've tried to do. And, you know, I love hearing about the community readiness process, because in all of us who are out on the front lines trying to lead change and lead improvement think that everybody's right there with us, and we know that that's not the case. So trying to make sure that we see, you know, where everybody is, and while we can't get everyone on the same page, we need to shift some paradigms. And a critical mass starts with, I don't know, it's something like 12 or 13%. So the traps that were identified, the traps that are really patterns of behaviors and patterns of thinking, and those patterns trap the possibilities to create equity. So in spaces where you're dealing with oppressive behaviors, there are issues that around inequities. And so those behaviors and those patterns of thinking trap equity. They stop it from being able to move forward. It's both individual and collective. And you know, with clients with whom you work, that it's both, it's certainly individual and collective. It's reinforced. Those traps are reinforced by assumptions and beliefs that we have. We can't just say they have, all of us as well. And so again, examining our own positionality helps us to see some of our own biases, and helps us to be able to surface and then address and challenge some of these traps. So the deficit view, you're familiar with deficit thinking, and the way that people who operate from a deficit view see the world is assuming that some people just have internal deficiencies. They may be based on race or culture. It may be based on poverty, and we have to be careful. We know that poverty certainly is a strong indicator for lots of dangerous behaviors, but we also we have to make sure that we don't see poverty as strictly a deficit. So people who live in poverty also have funds of knowledge, FUNDS, funds of knowledge. We'll talk about that a little bit later. So we have to be careful about that. Another way that we trap equity is through racial erasure. So people refuse to see color, and which ultimately is about an unwillingness to address race and racism. I would suggest it's not only racial erasure. This also can be applied to issues of linguistic diversity or cultural diversity. We have a community about 70 miles northeast of Denver, out on the Eastern Plains. That's a very small rural community. And 6 years ago, there was a large influx, a large migration of people from Eritrea and East Africa. And nobody had predicted this. Nobody saw it coming. There had been groups of people who identify as Hispanic living there for 100 years. And they had always underachieved in schools, for example, and they had always worked the blue collar kinds of jobs. And the dominant white view of looking at that was, well, that's just the way things are. And then along came these people who dressed differently and spoke differently, and they started praying 5 times a day. So the men who had been hired in the meatpacking plants got fired because they were praying 5 times a day, which was actually a good thing, because then that got agencies like the ACLU involved and said, wait, you can't fire people based on their religion. What happened, this paradigm did shift. So the entire county came together through lots of angry discussions and lots of people feeling like they were giving up power to come together and develop what's been now termed One Morgan. It's Morgan County. And it's genuinely a national model for inclusivity and issues like domestic violence have decreased as a result, even among people from the dominant culture. So another trap is what's called avoiding and using the gaze. And this comes from Foucault. There's a lot of really interesting research that shows that people who work with people who are what I term economically under-resourced. I don't like to call them poor, but they're economically under-resourced is a more positive way of phrasing that. People who work in communities that are economically under-resourced feel that like they're not being watched or scrutinized as much as they are in middle or upper income communities. And there are good things that come with that, and there are not so good things that come with that as well. And then the fourth trap is what it's referred to as paralogical beliefs. It's rationalizing our own beliefs by blaming other people. And some of these may sound familiar. We're pretty clear that all of us as human beings fall into at least one of these traps, periodically, if not often. So our goal as professionals is to break this cycle. And if we understand what equity traps are, and we recognize our own equity traps, which is where the work has to begin, then we can start reframing our own thinking, particularly about the clients with whom we're working. There are strategies to address these traps. And this is, I mentioned funds of knowledge. Funds of knowledge help us to move to an assets-based frame rather than a deficit frame, and helps us to reframe our thinking about the community. So I just finished a 3-year federal grant in 5 remote communities in Colorado, very, very different from each other. And it's really interesting how, knowing what I know that I'm sharing with you, I had to constantly be reframing my thinking about the huge assets in some of these communities. So as David was suggesting, there's absolutely no public transportation. They are in food deserts. Their medical supports are really difficult, if not non-existent. And yet there are some really amazing things that are happening there. And we have to be looking for some balance in order to be able to start generating some solutions together. We also can, for the second equity trap, we can read. And if you haven't come across Kendi's new book on how to be an anti-racist, it's spectacular. It's really amazing. And you can apply that work also to, again, to sexuality, to gender, to cultural difference, to linguistic difference, to ability differences. And you may be familiar with equity audits, and just the term audit sounds so bureaucratic and top down, but equity audits done well help to identify inequities across any number of different descriptors. They're co-created with the community. So it's not that anyone's doing it and telling someone how bad they are. It's all of us looking together at a number of issues and surfacing and then challenging what we find. In many cases, these are things that have existed for a long time, and so they become normalized when in fact they should never have been normalized. And so being able to do an audit helps us to identify them and really rethink our goals. The third trap is probably one of the easiest, if you will, to address, and that's really a genuine belief that all people can succeed. So I'm sure that many of the people with whom you work have all kinds of strikes against them and all kinds of challenges. And as Lindy suggests and Nicole suggests, that they work in a county that spans urban all the way to rural, and in counties that Sabrina talks about, where she has a big transportation problem and running into being an outsider. Yeah, being an outsider is huge. And I think it takes living somewhere for about 55 years to be considered an insider. The medical community, there's a really neat project called Project Echo out of the University of Wyoming that's connecting people in remote communities with really high quality medical services for free. And I'd be happy to connect you to some sources for that. So there are interview protocols that you can use with clients, or you can use in a number of different settings. to really surface and challenge those beliefs about traditionally marginalized people. Also helping people who have been traditionally marginalized to understand that they don't always have to be marginalized and that they don't have to be victims. So that co-creation of goals helps to give them voice. And even when they fall from grace on some of those goals, because they're iterative, you can get back in the saddle. And I don't mean to be naive about that. I know when you're dealing with opioid crises that we have life and death situations, but in terms of prevention, that's something that you can certainly consider. So the goal with equity traps is to identify them and then remove them. So I'd like you to think about what it would look like and sound like and feel like if you eliminated oppressive practices in your rural space. And just type it into the text box. What would it look like? You know, and I often say to people, if you got $1 million grant tomorrow, what changes would you make? What would be different? But what would it look like? What would the space in which you work, how would it be different if there were no longer any oppressive practices? And as you're doing that, I'm going to go to the next slide. And this is a slide about design thinking. And I include this only for you as a tool. It's not to lecture you about design thinking, but this is a tool that's become very, very useful for many people. It sometimes is a 4-step and sometimes is a 5-step, but the empathy at the top is the most important piece. So in design thinking, once you identify your problem of practice, you can engage in design thinking, and you can empathize, you can do empathy interviews, which you probably do all the time in your work. And you will try to find out what people's beliefs are, and which helps you establish your strategies that you're going to use as you work with them. You do that by interpreting what they're saying. Ideate is just a way to say you develop a model. So based on what you know works, or what you hear from a colleague is working, you have the opportunity then to just try a new model and apply it. Prototyping is just testing that model. And again, in like a 28-day cycle or a 40-day cycle, or however long you decide you and maybe another colleague want to do that. And then you look at the results. And that evolve is a really key piece. That evolve is about improvement. And I'm so done with people talking about just change for change's sake. So instead of change, I like to think about improvement. So when we go through a design thinking process, the goal is to improve. And if after you've applied a model and you've tested it, nothing worked or nothing improved, it's not a failure. Instead, it's given you some important information about something that you're not going to do, or you're going to adjust. And so you go back and you revise the model, you ideate differently. If it worked, which is wonderful, or if you saw a glimmer of hope about it making some headway, then you really can review it and see what was it that worked, what part of it worked, that it was something you did differently. So what was it that made that successful? And what other supports do you need to be able to continue it? I'm asking you to do a lot of writing and thinking today, but really important, related to issues of oppression, what are the 1 or 2 main issues that you deal with in rural areas? And it's going to be very important for you all to take part in this, so that we can start looking for patterns and we can find people who have common issues or problems of practice, and we can network you. I have a networked improvement community called a NIC in 42 states and 3 countries right now. I have no money that's been given to me for it. It's been done with no funding, and it's spectacular to watch what happens. It's only in rural spaces, and rural practitioners talking with other rural practitioners about things that are working. And nobody learns, we learn best from people who are either job alike or context alike or whatever it might be, not from somebody who is from the outside. So we know that people who are engaged in these challenging issues are really the experts in the challenge. The next slide suggests that we would look at this data that you're going to put into the text box, and we will compile them and look to see what the strengths are that you're able to work with and what your challenges are. On the next slide, there's a question about barriers and trying to identify what some of the local assumptions and beliefs are that act as supports or barriers to eliminate oppressive practices in rural Pennsylvania. So there are some things systemically that perpetuate the oppressive practices. And often people don't see the system that is creating that and is causing it to continue. We want to disrupt it. And we can't disrupt it until we can actually see that. So we want to know what those local assumptions and beliefs are, and we want to know what the structural barriers are. So sometimes people refer to it as policy, but it's possibly just practice, not even policy, but under the belief that this is what we do here. And that's the practice. So thinking about what are those local assumptions and beliefs that have maintained the status quo for a long time. And in that status quo, sadly, are a lot of perhaps increasingly oppressive practices. This is a framework. It's actually an educational framework, a new one, but I included in my slide deck to share with you what's being done actually across the country. This is about culturally responsive school leadership, and it would apply to community leadership as well. So Khalifa Goodman Davis did an analysis of 75 years of research on culturally responsive, or whatever the term was at the time, of different culturally responsive practices. And they boiled it down to 4, so those yellow squares. One is about critically self-reflecting on leadership behavior. So I hope that each one of you sees yourself as a leader in your field. You're a leader in your context. You're a leader who has the potential to really make a difference in the lives of the people with whom you work. And really critically self-reflecting on your behaviors, I would say your attitudes and practices as well, is important as we surface that positionality. Then developing culturally responsive teachers. Well, it's also about developing culturally responsive, all the people you work with. And there are people within agencies who need to be more culturally responsive. You hear people making lots of excuses, particularly for people who live in poverty. So if they're economically under-resourced, we have lots of excuses for why they do this behavior or why they do that behavior. And they're not causal. They're correlated, but they're not causal. The third square is about promoting culturally responsive and inclusive environments. So that again cuts across all kinds of descriptors, whether it's for gender equity, whether it's for linguistic equity. My husband was a superintendent principal in a rural community, and a Mongolian speaking child came to their community, and there were only 120 students K-12. And he had to convince a very white board of education that they needed to hire an ESL teacher to be able to support the needs of this child, when the teachers in fact thought he should just be in special education. And special education wasn't going to do him any good. He wasn't a special needs child. He actually had quite a few strengths that hadn't been identified. So that it's about shifting that kind of culture by promoting inclusive environments. And then the last is engaging children and families and communities in decisions. So I think we make a lot of decisions for people and do things to people, thinking that we know we have the answers. And in some cases we have some answers, but there's also a real power differential. And so the more we can engage members of the community and in decision-making with us, the more they have ownership of the responsibility for the success of it. I mentioned a few minutes ago about seeing the system, and you don't need to look at any of the squares on here, but this is understanding that all of us operate in very complex social systems. And it's kind of like the old carnival game whack-a-mole. If you only deal with one of these rectangles, another one's going to pop up somewhere. So understanding that the problems of practice with which you're dealing are very deeply complex, and that you really have to do interdisciplinary work in order to be able to start generating solutions. It's important as you develop anti-oppressive practices to shift from deficit to asset-based models. Instead of monitoring the pathology of your clients, that you co-create systems of support, that instead of having people just become numbers in the system, which happens very often within state agencies, that you can work on multi-tiered service delivery models, and that you see families as partners. I really like the word, I prefer the word families over parents. Lots of families aren't necessarily parents. And so seeing families as partners. So we're going to skip the next slide in the interest of time, and we'll go to the Plan to Study Act. This is a model that's been around since the 50s. It's very similar to design thinking. It's a 4-step, but it's very easy. And you'll see that those the arrows actually are double tipped because there's no end. So you decide what you're going to do and what you plan to do, what you're going to actually do. Then you think about what you learned in the process, and how, as a result of that, how will you either adopt it, adapt it, abandon it, or retest it. It's important that you and your clients develop some change ideas together. They can be really simple. So if A is the problem, what is B? What are some really simple changes that they and you collectively, or they individually, can make in their lives, and you can help to support in order to go back through that PDSA successfully. Next slide is about actionable planning. You have all kinds of these things in your repertoire, I'm sure, about goal setting and monitoring. The next slide talks about community cultural wealth. So many people in your community your communities who are viewed at deficits have all kinds of strengths, and being able to focus on their strengths is really important. I'm trying to read some of your notes that you've come across. Some of the things you're putting into the text boxes are things over which we have no control. So I would suggest also that, so as not to frustrate yourselves, that you identify those issues over which you have some influence, that you and your clients both have some interest, and then focusing on their strengths. So every one of your clients brings something unique to the table, and helping them identify what they can do and what their strengths are is a really important piece of therapeutic practices. So moving through 2 more slides, I'd want you to, as you go through your evaluation, to see if there's anything. These were the outcomes we were hoping to accomplish in a very short time today. I want you to go through there as you think about the webinar today and see if any of those were accomplished, if you feel like you have a little bit clearer understanding, or maybe even more importantly, if it's not clear but it's jostled your thinking about something, that's important too. And the last slide has my email address, and I would be more than happy to respond to any questions that you might have along the way. And thank you so much for your time.
So if anyone has any questions, please feel free to put them in the chat or in the Q&A, box. There was one question from earlier for David. Are there specific prevention programs that your staff utilizes to address this intersection of poverty and DV?
I would say that we are in the phase of really revamping and developing more specific programming. We don't have a lot of specific programming around the two, but certainly it's something that came out of our community readiness, and something that I, as the ED, have really looked at and am currently working with the board on.
Thank you, David. I'll give a couple more minutes just in case some folks have other questions for Christina. Well, awesome. Thank you all so much for participating today. Obviously, you see Dr. Hesbel's email right there if you have any questions for her. And of course, you all have our contact information, so feel free to reach out to us for any other questions or information that you may need or resources. Again, we really appreciate you all taking the time to be here and also taking the evaluation. And we really try to listen and take feedback from the evaluations. You know, this presentation today was a result of, hearing your feedback from other evaluations and wanting to make sure that we are addressing the needs that you all have. So thank you very much. Have a great day. Thank you.